Thank you for the introduction, and thank you all for being here today. And I'm happy to speak with you all regarding influenza. So influenza season officially began 3 days ago, October 1st. So I hope everybody has gotten their vaccinations or that is in the plan in the near future. And the season will continue on until April 31st or May 1st, and typically it peaks in December and January. And the reason why I do want to talk about the flu today is because we all tend to think it is it's a seasonal epidemic. It comes and goes every year. It's really no big deal. But in reality, it causes substantial morbidity and mortality. So on a yearly basis, we experience about 35,000 deaths as a result of influenza and about 250,000 hospitalizations. Okay, so that's very, very substantial. And the high-risk population are more susceptible to the effects of influenza. So the high-risk population essentially involves young children, pregnant women, and the elderly. As they have a decreased immune system function, they're more vulnerable to the side effects of influenza and have a high possibility of developing secondary bacterial complications. Okay, and we can never really predict the severity of influenza season. For example, last influenza season would be considered mild, the season for 2011 through 2012. But then on the contrary, 2009 was somewhat severe. So the severity of the influenza season is very, very, very difficult to predict. Okay, so some prevention tips for you all. Okay, prevention is very, very essential to ward off any type of viral infection. Okay, so first and foremost, wash your hands frequently with warm water for 15 to 20 seconds with soap and warm water. And this is so because viruses tend to thrive on inanimate objects such as this podium right here, or a table, or desks, or doorknobs, or phones even. Okay? And these viruses can stay on these inanimate objects for up to 2 hours. So it's very, very, very important to wash your hands consistently. Okay? Secondly, avoid touching your face. So on average, how many times, who in here can tell me how many times on average an individual touches his or her face on a daily basis? On average. 100. Any other guesses? 200. Okay. On average, we touch our face about 450 times per day. Okay, and that's a substantial amount just because the eyes, the mouth, and the nose, they serve as entry portals for the virus. So it's very, very important that we don't touch our face. You know, we may just be thinking or, massaging our head or whatever it may be, but we're still touching our face, and that's where viruses tend to thrive. Thirdly, avoid sharing objects. Objects such as phones, keyboards, any type of object that may be shared, it's very important to wipe it down before it is passed down to another person. Cover your mouth, okay? We typically, when we sneeze, we cover our mouth with our hand. That's not an appropriate way to cover your mouth, okay? You need a napkin or a handkerchief, or use your shoulder, as the viruses can thrive and be passed along very significantly. Get enough sleep and manage your stress. This is easier said than done, I know for sure, for many of us. We lead very stressful activities and daily lives, but it's very, very important to get at least 8 hours of sleep and manage your stress, as high levels of stress results in decreased immune function. So if you are exposed to a virus, you're not going to be able to ward it off as effectively. So it's very, very important to not stress often. Okay, and the last three kind of go hand in hand. Drink plenty of water, maintain a healthy diet, and eat and maintain exercise. Okay, this is very, very important to boosting your immune system. There are actually certain foods that help to boost your immune system as well. Just to name a few of them, almonds have high antioxidant properties. Garlic also has very, very high antioxidant properties. My husband loves to eat garlic, and he actually always smells like garlic for some reason. And then for the people who love sweets, dark chocolate in moderation is very, very good for you. Not only does it have heart health benefits, but it actually has many antioxidant properties as well as vitamin E that helps you ward off viral infections. Okay, so those are just some basic prevention measures. And also, limiting alcohol intake is very essential because it does cause dehydration in your body. So it's very important to limit alcohol intake and increase water intake. Okay. But the primary preventive mechanism are vaccinations. So if I can get by show of hands, how many of you have gotten your influenza vaccination thus far? One person, very good.
Did you count last year? How about attendance?
Although vaccinations, they only provide short-term immunity for lasting about 8 months, it is recommended to get vaccinations every year for the influenza, okay? And this is kind of the prime preventive mechanism to reduce transmissibility from one person to another. And as I mentioned before, influenza seasons are very, very unpredictable, okay? We can never predict if it's going to be a mild season or a severe season. And with this year, the global surveillance activities that have been conducted by the World Health Organization and the Centers for Disease Control and Prevention, they've identified that H3N2 is a significant strain that's circulating. And so H3N2 is part of the more substantial influenza strain, and they tend to cause more severe illness compared to the H1N1. So the vaccinations that you get this year will be effective against 3 strains. Your H1N1, H3N2, and a type B influenza that's also circulating. So it'll mostly be effective against those 3 basic strains. And as I mentioned before, H3N2 causes more severe illness compared to H1N1. So we may see a more severe influenza season this year compared to last year. And now there are actually 4 methods of the vaccination. You have your typical shot, and then you also have the flu mist, which is a nasal spray. You also have a high-dose vaccine that's specifically targeted to the elderly, age 65 and over. And then for those who may be afraid of a shot, you have what's called an intradermal shot. Okay, it's basically just a prick, 1-inch prick that goes into your skin. So it's not your typical shot, but rather it's a prick. And that's for the population aged 18 through 64. So vaccinations, again, are the primary preventive mechanism for influenza. And one last thing regarding vaccinations is that once you do receive a vaccination, it takes 2 weeks for it to become officially effective in your body and for your body to develop those antibodies and for you to become immune. So you still have that 2-week period when you can get influenza, even though you have had your vaccination. So that's something to take consideration of. Okay. So what happens if you get the flu? Okay, there are the primary treatment for influenza are antiviral medications, specifically Tamiflu and Relenza. So you're going to be most effective with the treatment if you present to the medical care professional within 24 to 78 hours of onset, okay? And this is where I'd like to talk a little bit about my research that I've conducted. Typically, we see that even though influenza is a viral illness, antiviral medications are the prime medication for treating the illness. We often see antibiotics prescribed for treatment of the illness. Now, antibiotics are an appropriate treatment if you are pregnant, if you are a child, or if you're elderly, because you're more likely to have those secondary bacterial complications. But for a healthy adult who just presents with influenza, a viral infection, that is not the appropriate treatment. And this is continued to lead to increasing antibiotic resistance, which is a significant public health concern. So I'd like to talk about my research that I've kind of built upon my dissertation, and I essentially looked at physicians' prescribing practices. I looked at what factors influence their behavior to prescribe or not prescribe antiviral medications. And so I used a secondary data set. It's the National Ambulatory Medical Care Survey. The physicians are nationally representative, so I had about 65,000 physicians and about 850,000 patients in this survey. And we essentially grouped their characteristics into three basic categories. We had patient characteristics, physician characteristics, and then the health facility characteristics. And so with patients, we looked at age of the patient, race of the patient, their insurance status, as well as their gender. Okay, for physicians, we looked at their degree, whether they had a medical degree or an osteopathic degree. We looked at whether they practiced in a private practice or a freestanding clinic or a group practice. And then we also looked to see if they were owners of the practice or whether they were just an employee. And then with the health facility characteristics, we looked to see what geographical location it was in, as well as its metropolitan status, whether it was more urban or more rural. And so after conducting these analyses, we essentially found that there are many, many factors that influence physicians' prescribing of antiviral medications. So first and foremost, physicians were significantly more likely to prescribe antiviral medications to their white Caucasian patients compared to the African American patients. Secondly, physicians were actually less likely to prescribe to patients who had private insurance compared to those who had other forms of insurance. Thirdly, physicians were less likely to prescribe to patients if physicians practiced in a, if they were owners of their facility, they were less likely to prescribe to patients if physicians were employees of the facility. And then lastly, physicians were more likely to prescribe antivirals if they were located in a metropolitan urban area compared to a more smaller rural area. And these findings corroborate findings of many other studies that have been done regarding this topic that's being presented. And it's very interesting seeing the results and how similar they were to previous studies. And it kind of means many things, okay? And another finding I forgot to mention, of these patients, 41% were prescribed antiviral medications, 43% were prescribed antibiotics. And then I need to remind you that my sample consists of only healthy adults age 18 through 64 presenting with a primary viral infection with no secondary bacterial infection, okay? So that's a very, very substantial discrepancy that we see. 41% antivirals, 43% antibiotics. And this essentially, there are many underlying factors for this. So first and foremost, I'm gonna group them into 5 categories. First and foremost is to do with patient satisfaction. Many patients actually go in the clinic expecting to be prescribed an antibiotic or demanding to be prescribed an antibiotic. And patient satisfaction is very, very important because patient satisfaction ratings of a clinic are commonly used as a quality indicator, okay? So essentially physicians want to satisfy their patients, and as a result, antibiotics are prescribed. Second factor is expediency, okay? So by not prescribing antibiotics, it's gonna require a greater investment of a physician's time, okay? So explaining to the patient why an antibiotic is inappropriate, why antiviral medications should be the primary medicine, the long-term effects of inappropriate use of antibiotics, it takes time. And the primary goal of a physician is to maximize patient flow. So you want to maximize patient flow, ensure patient satisfaction, right? Those are the keys. So that's the second group of factors. Third group of factors relate to uncertainty about the diagnosis, okay? Influenza is one of those illnesses where the symptoms are very, very similar to other respiratory infections. So typically there is this notion of uncertainty. Physicians do conduct what's called rapid influenza testing. It allows for a very, very quick diagnosis of the flu, typically within 15 minutes, but the test has been shown to be fairly ineffective. It actually correctly identifies about 60% of influenza cases, and it does have a lot of false positives and false negatives. So there is this uncertainty about diagnosis. So if physicians feel that there is this small chance of you developing a bacterial complication, you're going to be prescribed an antibiotic. Fourth factor, essentially it may reduce risks. The benefits may outweigh the risks, essentially, by prescribing an antibiotic. And what I mean by this is that if you do present with a viral illness, say you do have a 1.5 to 2% chance of developing some sort of bacterial complication. Okay, so by prescribing antibiotic, the benefits may essentially outweigh the risks. And then the last factor, it has to do with marketing. With the marketing of pharmaceutical industry to physicians, it has a substantial effect on their prescribing behavior. And with the advent of direct-to-consumer marketing, essentially marketing to the US population, it affects patient demand as well. Now, I don't know if you know this, but there are only 2 countries in the world that allow direct-to-consumer marketing of pharmaceuticals, and that's the US and New Zealand. Those are the only 2 countries. No other countries allow pharmaceutical marketing to the population. So that may play a role as well. And Pfizer is a prime example of the marketing example of their Z-Pack, okay? They use a cartoon to market their product, and their target audience is parents of children who develop ear infections. There have been other medicines that have been proven to be cost-effective compared to the Z-Pack, but their marketing strategy has allowed them that segment of the population. So there are all of these various factors to consider when you are presented with a viral infection, and these are questions that you need to ask your doctor. You know, if you are being prescribed an antibiotic, you need to know why. If you do have some sort of secondary bacterial complication, because inappropriate prescribing and misprescribing is greatly going to lead to antibiotic resistance, and that's a substantial problem, okay? Many people are becoming resistant to the group of penicillin, okay? And once you become resistant, it's very, very difficult to treat a bacterial infection. So I'm going to end today by saying, be prepared for the flu. You know, take care of your own health, not just for this influenza season, but take the necessary preventive measures for any type of health-related issue, any type of viral infection, and be aware and knowledgeable when you go to the doctor regarding the treatment that you seek regarding the flu. So be prepared and fight the flu this season. So that's all I have. Are there any questions I can answer?
What's the physician's response then to your research? Are they defensive?
They are. Actually, many physicians do admit to this. There have been some. I began this research initially in Alabama, so I haven't really gotten any response here in Evansville. But in Alabama, many physicians actually admit it's the issue of time, and patient satisfaction is the prime factor in prescribing antibiotics. And this is one of the reasons that the CDC is developing an entire antibiotic resistance plan to distribute to primary care physicians, to create that knowledge and awareness and to let them know that this is a significant public health threat. Yes?
I was interested in hearing how you identified these are the reasons that physicians do this. So, because that's not available in your data. So,
right.
Did you talk to physicians, or is this your theory?
This is two-part actually. These reasons come from findings from previous research studies, and also these findings come from my conceptual framework that I used. It's called the Eisenberg's framework of clinical decision making, and that's what this framework identifies, is that various factors affect physicians' decision to prescribe. Essentially, when you're in the clinical setting, there are many decisions involved. And when you're prescribing a medicine, it's essentially a decision, whether to prescribe or not prescribe. So it goes along, it's two-part. Yes. Yes. Actually, previous studies that have been done, I know you would expect the findings to be the reverse, right? They would be more likely to prescribe to private insurance, but actually previous findings have said that they are actually more likely to prescribe to those who are on Medicare compared to private insurance or some other form of governmental insurance. So they for the most part, prescribe more to the elderly, and although elderly weren't included in my study. Yeah. Yes.
I did go get my flu shot last weekend, and they offered all the gazillion different kinds, and I didn't know about the Antiviral one before I went. I didn't really know if there was like an advantage to one over the other, if it's more likely to protect you. I was like, just give me the old school version.
They all actually have the same effectiveness. So with any shot you get, you still have that 2-week window where you are susceptible to the virus. But if you get the prick or the nasal spray or your typical flu shot, it's all same, very similar effectiveness. I'm sorry. It has shown to be equally effective because there are some people who cannot be given a needle. And when you look at the effectiveness rates, they may vary by 1 or 2%, but it is said to be highly effective. Right. Yes.
What did you say to recommend for the elderly?
It's a high-dose vaccine.
High-dose vaccine?
That's what it's called. It's a high-dose vaccine. And this is so just because the mortality rates that we see and the hospitalizations, the primary group is the elderly. And so that's why the high-dose vaccine provides us more antibodies to the elderly. And as a result, they may be better able to fight off the infection.
For that, or was it
Yes.
like
You'll have to ask for it.
And at what age? Did you say 65?
65 and over. And with all of these options that I mentioned, if you don't ask for it, you're most likely going to be receiving your typical vaccine. So you have to kind of inquire about it. But there are 4 available. So.
How do the vaccines vary in different parts of the world? Like we have students studying in England. I mean, is there a big difference? Or I guess another question would be, how many mixtures are there throughout the world?
Regarding the components. So here in the US, we have this year's vaccine, as I mentioned before, contains the H1N1, H3N2, and the type B. So with various parts of the world, it all goes back to the World Health Organization's surveillance. So they look at, okay, what virus was most prevalent last year, and they put that in the vaccine, and they also look at what types of strains are more prevalent this year. So it varies within countries. And there are different manufacturers of the vaccines for countries around the world. Yes.
From a patient standpoint, my husband's one of the worst about call and ask for his impact. You know, I've got whatever and I'm going to die, or we're going somewhere in 2 days and I want to be better. How do you define the flu versus, from a patient standpoint, what might help if you're the one that's just calling to tell your doctor what's wrong with you? How should we describe?
Well, you would go about first describing your symptoms, and if it is during flu season, the healthcare professional should know it's some sort of a viral respiratory type infection. And particularly given, say, if you get it in November or December, they should fairly well be able to identify that it is the flu. So that's how I would kind of go about it. Now, many people, when they have the flu, they take antibiotics, and they say, well, I took an antibiotic, I feel completely better. But in reality, the flu is just taking its natural course. The flu typically resolves on its own within 5 to 7 days, or 2 weeks max. So in reality, you are taking antibiotics, yes, but it's not really affecting your viral illness. The flu is just taking its natural course to healing.
Feel bad. So are you saying most people who feel badly during that time period with a respiratory thing probably is the flu?
Most likely, yes. But when you experience any type of flu-like symptoms like fever, nausea, fatigue, whatever it may be, it's good to seek medical attention and get it confirmed. So if you do have the flu, you can start the antiviral treatments, because the sooner you begin, the more effective the treatments will be.
And consulting somewhere other than
Well,
was
and,
recommended.
I know, and I know a number of people that do that. Though back to the patient satisfaction, that you said that probably shouldn't do that at all. You know, no,
Right.
you're not. you're not getting that, so you come see me, and I know it's wrong.
Right, right, absolutely. But the patient satisfaction is a tremendous factor with not just the flu, but with any type of illness or disease that you go see. I mean, antibiotics are very much inappropriately prescribed just to maintain that patient satisfaction. Yes.
With all the changes and proposed changes in health laws and healthcare, is that going to affect prescription or vaccinations and prescriptions and doctors' willingness and ability to give that?
Oh, with the new healthcare reform, you mean? I would think so. I would actually think that vaccinations are going to increase significantly just because many of your preventive diagnostic services are going to be available without any copay or any deductible or whatever it may be. I also feel that with this reform, hopefully this will bring about more stringent guidelines, and with the implementation of the CDC's antibiotic resistance program, hopefully this will cause some sort of behavioral change in many of these primary care physicians and have them adhere to the guidelines that are recommended. I forgot to mention that the physicians I specifically looked at were family practice and general pediatricians, internal medicine, and gynecologists. So those were kind of the 4 groups. But hopefully we would expect to see more adherence to the guidelines as a result of all of this.
So did you say H3N2 is worse? You know, we scared ourselves
So
to
when you-
death about H1N1.
So when you look at the severity scale, H1N1 is actually mild. The type B is intermediate, and then H3N2 is the most severe.
And it looks like this might be a year where that's
Mhm.
more prevalent.
Yeah, global surveillance has indicated that H3N2 may be more prevalent compared to H1N1.
So would you say now more than ever people should be getting their
Absolutely. This is one of the best times. I mean, vaccination rates currently are at about 32%, so that's pretty good, but we should strive to achieve higher rates.
For whom is that available free of charge? Is Medicare, right?
Currently, vaccinations, yes.
Anyone else?
Not that I know of, no. Beginning with this healthcare reform, beginning in 2014, this will be available for free since it's considered a preventive diagnostic measure, but currently it is not. I think the average cost is about $20 or $25 or something.
That's the cost? What is it?
For a vaccination, yes.
The health department gave them last year for we were talking about that in our office the other day. You get them at the health
Right.
department for $8, $10, something like that.
At a discounted
It's
rate.
open to anyone.
Mhm. But at your typical CVS, Walgreens, Schnucks, it ranges from about average $20, I would say.
There's actually been a lot written about the marketing of the vaccine and how these people want to drive business. And I noticed at Sam's Club, they've got these contract nurses, and they've got tables set up, you get your vaccination there. So they seem to be popping up like everywhere, from Walmart to Sam's Club to CVS. And CVS is trying to draw you in there to get your pharmacy business and buy some milk and Coke. So there's been some good things that have been written about.
Right.
You know, it's not necessarily, they don't have the same incentive that the insurance company would have
Right.
to try to keep you out of the hospital and that.
Right, right,
But they've been very helpful.
right. Very interesting, yeah.
You mentioned the direct-to-consumer marketing, which I think is incredible what we have in this country. I don't know the year that became.
It was actually 1959, I believe.
Yeah, because I remember 1959.
I thought,
Well, I don't know. Anyway, it seems very strange to me that we do that, and I wonder why we do, and I wonder if that would be anything that our country will be brave enough to take on.
it's one of those, that's one of the most controversial, debatable issues these days is, should prescription drugs be marketed directly to the population? Because it really affects the population's perceptions of various drugs, you know, and I truly believe we're marketing it for the wrong purpose. So, you know, and it kind of tells you that there's only one other country in the world that's doing this. So it'll be very interesting to see how we go about doing this. I mean, I'm not sure if we'll, permanently remove marketing. It may decrease somewhat, but marketing is a substantial effort by the pharmaceutical industry to increase their drug sales and drug revenues, not only to patients, but also to the physicians at the same time.
Well, it's also unfortunate in our country, I think it's one of the few developed countries that continues to use antibiotics routinely in animals.
Right, and
So that's a big plan.
I just went over this in my class. I mean, majority of the animals are given antibiotics to reduce disease and enhance growth, right? So they grow faster. And not only are we ingesting these antibiotics in very minute amounts, but we're also breathing them in, drinking them from the water or whatever it may be. So all of those factors, not only inappropriate use, but a variety of factors contribute to this antibiotic resistance that we're currently seeing.
What other countries allow this currently? Do you know, the addition to animal feed?
No European countries allow. They raise their animals on purely grass. No antibiotics are allowed. As far as I know, I think the U.S., but I'm not sure of any other countries.
Shame on us.
Because if you need it sometime.
Anybody else?
Payal, we really appreciate
Thank you very
your
much.
being here today. I'm sorry that we were a bit subjected to the beautiful weather, but